I'm disability attorney Nancy Cavey. Welcome to Winning Isn't Easy. I'm going to be talking about degenerative conditions of the shoulder and the knee, and I have a special guest, the local orthopedist we refer cases to, Dr. Braun. Let's first talk about degenerative conditions of the shoulder. There are many causes of degenerative conditions. You can have spurs, you can have degenerative tears, you can actually have an acute injury to the shoulder or the shoulder joint. That can result in difficulty putting your arms above yourself, your arms out in front of you. Sometimes we'll even have tingling and numbness of the fingers, and that can result in a disability claim, particularly if you have complications of injury or the degenerative condition, or you're having complications because of treatment. It's really also important that you understand how disability insurance companies view these claims. And they view degenerative condition claims in a manner that I think may surprise you. By that, I mean, most of the time, they're looking at acute injury cases. A person has injured their shoulder or injured their knee in a work-related accident or an automobile accident or slip and fall at home. And they are looking at the acute nature of the medical condition, the basis of the diagnosis, the treatment, and they expect a really quick recovery period of time. In fact, they use medical disability duration guidelines in a lot of these degenerative claims. And as you will hear when we talk to Dr. Braun, it's really important that this is a team approach. And by that, I mean, we want to make sure that you are giving your physician an accurate history of your symptoms and how those symptoms impact your ability to function. So, for example, if you have a knee condition, you might have swelling, popping, locking. You might have give way. You might have difficulty standing or walking. You might have to change positions frequently because of the problems with the knee. Those are the kinds of things that you want to be documenting in your medical chart. I love what Dr. Braun had to say about keeping a diary or an interval history form. That's something that we recommend in our practice. Why is that? Well, a disability insurance company is going to be looking at your medical records. And as they're looking at your medical records, they're obviously, as I said, looking for the history. But they're also looking at the medical records for the objective basis of the diagnosis. What's the results of MRIs, CT scans? If you've had surgery, what's the operative report show? What's your post-operative recovery course? Have you had physical therapy? Did you benefit from the physical therapy? Have you had injections, be it in your shoulder or your knee? Are you having ongoing symptoms that impact your ability to perform your own or any occupation? I think, again, it's important that we're doing this as a team, and finding a physician who is willing to take this team approach can be difficult. And having a doctor and their staff deal with you can be difficult. And I love Dr. Braun's suggestions and comments about how to do this.